In this video, I will show you 3 simple, easy, effective stretches to help relieve mid-back pain, mid-back stiffness, and for some, you may even feel a change in as little as 30 seconds. So keep watching. Hi, I'm Dr. Marc Dupuis, a corrective care chiropractor in Sanford, Maine. If your mid-back feels tight, achy, stiff from hours driving, hours on the computer, or perhaps the phone, then this routine is for you. Most people try random stretches, but the problem is they never really restore true thoracic mobility. So this routine really is for you. First, I'm going to give you 3 posture reset tips. That way you're not feeding into the poor posture all day long. Then we'll progress to 3 thoracic mobility exercises. These exercises are designed to open up the mid back, decrease tension in the neck and the shoulders, and in many cases, improve the ability to breathe easier. These are the basic movements that we have used with thousands of our patients over the years. Thoracic mobility is a very important component of athletic performance because thoracic mobility is tied so closely to VO2 max and even plays a critical role in proper run form. Be sure to watch to the end because after I start with the 3 basic thoracic mobility exercises, I'll give you one advanced thoracic mobility exercise. One quick note before we begin. Watch this video from start to finish. The posture reset tips set you up so the exercises work better, and then each exercise builds on the previous one. Make sure don't force yourself. These exercises should feel good. You should never have any pain, never push through pain when we're doing mobility exercises. Any questions about if they're fit for you, make sure you ask your physician before you dive in. Okay, posture reset tip number 1. I want you to think about taking an eye hook that has a little screw at the bottom of it. If you are sitting, if you are standing, how do we make sure that we are sitting tall, standing tall? So I want you to picture taking an eye hook and screwing it right into the top of your head. Now, if you had a rope or a cord that you were going to attach to the hook and the eye hook, and then pull straight up, what would that feel like? If you catch yourself slumping, picture, okay, I've got the eye hook with the rope and it is pulling me tall. So when I'm sitting, I want to be up nice and tall. When I'm standing, we want to feel, what would it feel like? Try to imagine if we were being pulled from the vertex of our head. That is a really simple way to check in and make sure, hey, are we sitting tall? Are we standing tall? Now, the second posture reset tip is when you are sitting, we often want to take some breaks and you want to roll your shoulders up. Here's the key, back and down, shoulders up, back and down. And then once those shoulders come back, I want to just gently tip my head back. It's almost like a modified Brugger's, a very simple exercise. Roll those shoulders up, back, and then down, and tip that head down. If you can, put your palms up. Again, shoulders back, down, slight roll up of the palms. Tip the head back, take some deep breaths in through the nose, out through the mouth. 2 or 3 breaths like this every 20, 30, 40 minutes when you're sitting, and that can really help to reset your posture and get some fresh oxygen in circulating through your body. Posture tip reset number 3. All you gotta do is find a wall. I've got a door that I'm using for this example, but if you think you're standing tall, are you standing tall? How can we use something and check in and make sure that we are indeed standing tall and erect? So just back up against a wall. Only a door if it's propped like this one is. I want to make sure my heels are against the door, the wall. Heels are against the wall. Your buttocks is against the wall. Back and shoulders should be against the wall. Head should be against the wall. So when everything is touching, head, shoulders, upper back, buttocks, heels, now we know as long as that wall is plumb vertical, we are indeed standing erect. What you should notice is that when we are fully erect, it's even easier to take those breaths in through the nose, out through the mouth, 3 or so nice and slow breaths like that. Do this a few times throughout the day. You can do it every hour, every 30 minutes if you can. And that can really help to reset that posture. So again, we're not feeding into slump posture, tight neck and shoulders all day long. Now let's get into the meat and potatoes. So the first exercise for improving thoracic mobility are wall angels. This basically builds off of that final third posture reset tip. We go against the wall, heels, buttocks, back, head, shoulders, and then I'm gonna flip my arms up almost into like a field goal stand posture, if you will. Now, elbows against the wall, wrists against the wall, and then we're gonna go up and down. We're literally making like wall angels, almost like if we were making the snow angels on the ground. And we go nice and slow. We want to try to build up, if we can, 10, 15 reps, nice and slow, breathing in through the nose, out through the mouth. And when you come out of that wall, you should feel a nice stretch in the pecs. The shoulders should feel back and down. We should be able to feel, hey, we're more erect, we're breathing better, we're breathing easier. Again, wall angels you can do 2 to 3 times a day. 10 reps nice and slow. If you have shoulder injuries, if there is pain and you can't get your shoulders up, this exercise is not for you, so we don't force it, but only if you can comfortably get your elbows, wrists against the wall and make a nice slow movement up and down. All right, this next exercise is a classic cat cow. We start by going on all fours. I want my knees directly under my hips. I want my wrists under my shoulders. I'm making a nice flat table with my upper back. I'm looking straight down to the ground, so I'm not torquing my neck in any direction. And then now I'm going to take a breath in, and I'm going to let my belly button drop to the floor as I start to look up. Look up, let that belly button drop, and we hold for 1, 2, 3, and then blow out. Arch your back like a cat. Look down with your chin towards your chest. Hold for a few seconds. We breathe in. Hold 1, 2, 3. Arch. Look down. 1, 2, 3. 1, 2, 3. 1, 2, 3. We go nice and slow, 10 repetitions at a time, and that can really help to improve general mobility in your thoracic spine. All right, this third exercise starts in the same position that we were in for cat cow. This is called thread the needle. What we're going to do, I'm going to use my right arm first. I'm going to pick that up and rotate to the right. And then as I rotate to my left, this right arm is going to slide underneath like I am threading the needle. Let your head rest. Take some slow breaths in through the nose, out through the mouth. And we slowly unwind that. I like to take at least a good 3 solid breaths. We do the other side. I rotate away, and then I rotate through. Let the head drop down. Nice breaths in through the nose, out through the mouth. Then slowly unwind it. Okay, now that you made it through the 3 basic thoracic mobility exercises, I'm going to show you one more advanced move that's one of my favorite go-tos for upper thoracic mobility. It's great to do pre-workout, pre-run, pre-ride to really open up the shoulders, open up the thoracic spine so you breathe better and get ready for whatever it is you are about to tackle. For this last bonus exercise, we start out with your knees bent about the length away from your feet are at the edge of your fingertips. And then what you're going to do from here is you're going to go up into a bridge position. So we use our glutes, we use our hamstrings, we come up to form a nice bridge. And then what we're going to do is I'm going to take one hand and reach it across the opposite shoulder. Now, my upper body is going to rotate, inducing thoracic mobility, but I'm keeping my feet planted. So my pelvis is relatively neutral. And then from here, I reach across the opposite shoulder. Nice and slow. You go back to the bridge, reach across to the opposite shoulder. You go nice and slow, 5 to 10 reps in each direction. Whatever feels right. Again, we don't force it. And this is a great way to really open up that upper thoracic spine. Keeping your thoracic spine moving, functioning well, and with good posture is a crucial component of feeling better with less pain. Your thoracic spine also plays a bigger role in your overall health than most people realize. See, thoracic mobility, thoracic function is directly related to lung function, lung capacity, the ability to take in oxygen circulated to the brain, to your muscles, to your vital organs. It's something that we don't often think about. And when you take a look out, what do you see out in the general population? Especially because of our modern electric devices, we are seeing more rounding of the shoulders, more hunching. We even call that adult spinal deformity. That's a hunching that's more than 2 inches forward on the side plane. That is directly correlated with more pain, more disability, even a shortened lifespan. So these exercises and stretches, while they are very important to improve your posture, reduce pain and tightness, they can have an overall tremendous effect on your health. Let me know in the comments which move or exercise helped you the most. Was it the wall angels? Was it thread the needle? Perhaps it was the advanced overhead reach. Also, drop in the comments, are there any other areas that you are having trouble with, you need help with? Let me know, and I'll see if I can produce a video that will address some of those comments or some of those questions, should I say. If you found value in this video, like it, share it with anyone that you know that sits a lot, whether it be for driving, if they're on the computer, if they're on their phone, or if they complain about tight, stiff, achy backs and necks. Share it with those folks, and you may be able to help them. The next video you should watch will be linked right next to me. In this video, I will go deeper into posture. We will dive into why ignoring hunch posture, why ignoring decreased thoracic mobility can really lead to a significant loss of function in life and can even put you on the path towards needing nursing home care in the future. Go ahead and watch this video next.